Hello, everybody. This presentation is about the lack of communication and cooperation among the diabetes community in Iraq. I'm pretending to be a project manager at the IDA, the Iraqi Diabetes Association. My primary audience are the managers at the Iraqi Diabetes Association. First off, who are the diabetes community? The diabetes community does not just include diabetes patients, whether it includes any facility, organization, marketing agency, or simply put, any person who is interested in diabetes for whatever the reason might be. This might not be the definition adopted by all, but it is the definition that I will confirm to throughout this presentation. Second question on the slide is, what is the difference between communication and cooperation? Communication is about communicating information, products, data, which is done through cooperation by cooperating people and organizations and so on. The relationship between communication and cooperation is a mutual benefit relationship because more communication leads to more cooperation and more cooperation leads to more communication. Third question, why is communication and cooperation important for the diabetes community? Now, diabetes is a chronic disease, meaning that there is no cure for it. On the onset of diabetes, that is when a person is first diagnosed with diabetes, they're hit by this fact first, and then they're hit by confusion. This confusion doesn't occur at the beginning only, this confusion manifests itself every once in a while throughout the lifetime of a diabetic. If we go inside the head or the mind of a diabetic person, we'll see that what causes confusion is basically these factors. First, that they need people who can answer the questions, that they need to know from where they can buy their products. They need explanations for strange occurrences. They need to find people like them who would actually understand their struggle. And they need to find the motive to take care of their lives. All these factors could actually be greatly alleviated through establishing a communication system. The methodology that I followed in getting my sources is basically the second sources. Most of my sources are from the World Health Organization, the American Diabetes Federation, scholarly articles, and case studies in Iraq. Since this topic depends on variables that change as time passes, I try to gather as much as up-to-date information as possible. Results, causal factors. The first causal factor of this problem is that we have a fragmented health information system. This means that the private and public sector do not share data between them. The government sector reports data back to the ministry, whilst the private sector does not. This isn't the sole reason for this fragmented health system. There is a little mention of any organizational data in online databases, which serves to show what a small role diabetes organizations are playing in the whole realm of this process and how they are disconnected from other health facilities. Second causal factor, fear of change and of creative solutions and plans. Organizations lack creativity. The programs that are administered usually consist of repetitive and boring activities and therefore do not interest diabetes patients. Workers within an organization are afraid to suggest new ideas to their managers, and there aren't any surveys addressed to the patients to propose any suggestions. Third causal factor is the lack of online/social media presence. The association hardly has any social media presence. It does not even have a website, let alone other diabetes organizations. Internet is a service that is available to the majority in Iraq. Therefore, by not being active online, organizations have little chance of reaching out to all people. Last causal factor here is that poor managerial practices among associations and health centers. The causal factor, fear of change, and this factor are very related. It's the manager's responsibility to create a comfortable work environment where workers can voice their opinions and suggestions. There also seem to be some communication problems between managers of one organization and another. Each organization works independently, which ultimately cut ties within the web of connections among the community. And now to the solutions. The first solution is creating a diabetes health database shared by all health sectors and diabetes organizations. Imagine a database of diabetes patients' information, which of course does not disclose patients' personal information, that could be edited by all health facilities and viewed by the public, including marketing agencies. Such kind of data allows for more thorough research and for more innovations. Second solution, introducing health mobile systems for diabetes management to as many patients as possible. A case study in Iraq introduced mobile systems for diabetes management to a sample of patients, and after a while, the patients took blood tests which showed that their control over their blood sugar has actually improved. Not only are these mobile systems directly useful for patients, but they're also useful for health facilities since they provide them with user input data. Third solution, using social media as a primary platform to promote for an expanding communication. The best advertisements are the ones on the internet. If we want to reach out to the diabetes community, it needs to be done through social media. This, however, requires funding from interested investors or from the government. Fourth solution, providing training for managers and workers in health facilities. There are many countries that have widely established diabetes centers or organizations from where we can learn and train our staff on how to manage the organization well and introduce new and creative programs to it. We need to contact these organizations and ask them if they are interested in training our staff. Last solution here is encouraging marketing agencies to sell and advertise their diabetes-related products. This solution would most probably come as a follow-up solution after the database solution. Marketing agencies need to see real and reliable data in order to measure the demand for their products, and they would also need to run surveys based on that data. Marketing will create a communication web that is based on selling diabetes products to clients within the diabetes community. Lastly, and to conclude, establishing a communication system that encompasses the whole of the diabetes community requires cooperation from all ends. What I would recommend is first, creating a website for the organization, second, investing in or finding investors who are willing to invest in promoting our presence on social media, third, contacting abroad organizations to train our staff and members, fourth, introducing mobile health systems to the community, fifth, to collaborate with other health facilities to launch a shared database, and lastly, to contact and collaborate with marketing agencies interested in selling their diabetes products in Iraq. And this would be the end of my presentation. Thank you.